everyone, this is Michelle from the Snoring Clinic. Welcome to another episode of Sleep Talk. Okay, today we've got a very special guest with us. He's none other than Dr. Han Hong Juan from the ENT Voice and Snoring Clinic. Hi, Dr. Han.
Hi, Michelle.
Thank you for agreeing to do this.
My pleasure.
Thank you. Okay, so today we're going to talk about some treatment options should a patient be diagnosed with obstructive sleep apnea. Yeah?
Okay.
So can you tell us what are the different classifications of severity for sleep apnea?
So if you are diagnosed with obstructive sleep apnea, you may be diagnosed with either mild, moderate, or severe obstructive sleep apnea. And this depends on the number of times that you have breathing interruptions or breathing difficulties per hour of sleep. So, if you have less than 15 breathing interruptions per hour of sleep, it's considered mild obstructive sleep apnea. Between 15 to 30 breathing interruptions per hour of sleep, you have moderate sleep apnea. And if you have more than 30 breathing interruptions per hour of sleep, then unfortunately you have severe sleep apnea. As a frame of reference, a normal person would have less than 5 breathing interruptions per hour of sleep.
Right, okay. So, let's say if I have mild sleep apnea.
Yes.
Do I need to do anything with it?
Well, if you have really very mild sleep apnea and you don't have symptoms, then sometimes medical treatment may not be necessary. So for instance, if you were overweight or obese, then the first course of action would be to lose that weight, and it would help you. And if your sleep apnea is at a level that your physicians feel would not increase any health risks in the future, then they may opt to observe you and ask you to exercise regularly and to adopt good sleep hygiene practices. And so medical treatment may or may not be necessary in mild sleep apnea.
Right. So, okay, when you spoke about symptoms, right? If I have mild sleep apnea but I do not have any symptoms, what kind of symptoms are we looking at?
Well, a very common symptom would be disruptive snoring. If the snoring either troubles your family members or even yourself, and it poses a problem. So that's one very common symptom. The next symptom is what we call excessive daytime sleepiness, where you feel tired even after obtaining adequate sleep. For instance, 7 to 9 hours of sleep every night, and you still feel very tired in the morning. You doze off in the day. The third thing would be if you were recently diagnosed with, like for instance, hypertension, high blood pressure, and one of the reasons for that may be the sleep apnea. So these are the common kind of like symptoms that people present with. Of course, some people have morning headaches when they wake up in the morning. Some people have dry throat. Some people grind and they can crack a tooth when they sleep. These are the other symptoms that we often also think about. Yes.
Okay. So are we saying that for mild sleep apnea, if we are not symptomatic, we can just leave it be? Or should we actually revisit it, like down the road? Like, do we have to redo a sleep test a few years down the road just to see if it's worsened or...
So that's a good question. So unfortunately, sleep apnea is a disease that often progresses as we get older, and also if we get heavier. So for instance, you may not have symptoms now, it may not trouble you, but in the future, it may worsen and it may cause health problems. So yes, it's important to monitor your symptoms. If you do not have any symptoms currently, but you develop these symptoms later on, then it's important for you to take note that this may be a sign your sleep apnea is worsening and it's going to start causing health problems for you. So I would say that I have broadly 3 categories of patients that I normally see. The first category is usually the asymptomatic patient, the younger patient who has just gotten married, and then the bed partner now complains of snoring. The second group of patients that I see are the older middle-aged patients who start to have symptoms: excessive daytime sleepiness, morning headaches, dry throat, fatigability, poor memory, poor cognitive function, and they feel bothered because they know that they're not getting good sleep. So that's the second category of patients. Now, unfortunately, the third category of patients that I see are the older patients who have experienced either like a heart attack or a minor stroke or even a major stroke. And then they come and see me because when their family doctors or their other doctors go through their history, they find that they have the signs and symptoms of sleep apnea, and they've been suffering from it for many, many years. So I would say that just because you don't have symptoms, or if you're diagnosed with mild sleep apnea, that doesn't mean that you're off the hook. You still have to continually monitor whether or not things are worsening for you, especially when you wake up or during sleep, and then get the appropriate attention it deserves.
Right, okay, that's interesting. Okay, so that was mild, right? Mild,
Yes, mild sleep apnea.
So how about moderate? Like, what should I do if I have moderate, if I've been told that I've got moderate sleep apnea?
So I would say that the moment you have moderate sleep apnea, then studies have shown, and the data shows that it starts to pose a health risk. So you have increased risk of cardiovascular problems like heart attacks, strokes, high blood pressure. You also have increased risk of neurocognitive problems, poor memory, sleepiness during the day, increased risk of motor vehicle accidents. So for all these reasons, anyone with anyone with moderate or severe sleep apnea would require treatment. And of course, there are treatment options that are available for either moderate or severe sleep apnea. But it's important to impress upon your audience that, it's something that shouldn't be left alone, because eventually it will catch up with you.
Right, okay. So talking about treatment options, we always hear about CPAP therapy.
Yes, yeah.
Are there any other treatment options? Because we do hear of patients that cannot tolerate, the CPAP. So what are the treatment options, or what is the first choice that the first line of treatment which you would actually recommend to your patients if they have obstructive sleep apnea?
Okay, so I would say the first port of call for anyone with moderate or severe sleep apnea is CPAP. Number one, because it's non-invasive. Number two, because it's very effective. Okay, it's as a treatment modality. I know that a lot of patients look at it with a little bit of apprehension because it's something that you have to put on every night, and then they feel that it's an encumbrance on their life and their lifestyle. But the data shows that it's very effective when you use it. So anyone with moderate or severe sleep apnea, I would highly recommend that they try it. Now, CPAP is non-invasive. It doesn't involve any risk. Okay, you can always try it to see if it's something that you can get used to. And if you can't get used to it, then of course, we will have to offer you other treatment options as well.
So, okay, at least there are other options.
Yeah.
So what are the other options we're looking at?
So I would say that broadly speaking, CPAP is one of the pillars of treatment for sleep apnea. If you have moderate sleep apnea or mild sleep apnea with symptoms, then something called an oral appliance for sleep apnea can be also used. So an oral appliance is a dental device that you put on your upper and your lower teeth, and the main purpose of it is to keep your airway open at night when you sleep. So it's almost like a device that it's almost like a nightly retainer that you put on. But what it does, other than keeping your teeth straight or in place, is that it holds your jaw and your tongue forward and in place, and it prevents your airway from collapsing during sleep. So this has been found to be effective in mild and moderate sleep apnea. For severe sleep apnea, unfortunately, it hasn't been found to be that effective. So in cases where patients with severe sleep apnea who cannot tolerate CPAP, or they have given CPAP a go and they want to explore other options, then the next option, really, the next big group of treatment options is surgery. And surgery aims to modify the upper airway to reduce airway narrowing so as to achieve a reduction in the severity of sleep apnea and hopefully effect what we all hope to be a cure for your sleep apnea. So I would say the main three groups of treatment include 1, CPAP, 2, oral appliances if you have mild or moderate sleep apnea, and then surgery. And surgery can be employed with anyone with mild, moderate, or severe sleep apnea. Yep.
Right. Okay. So does that mean that if I take on any of these options, right, whether it's CPAP therapy, oral appliance therapy, or surgery, I will be cured of obstructive sleep apnea?
Well, unfortunately, no, Michelle. Okay, so anyway, think of obstructive sleep apnea as a chronic disease. Very much like high blood pressure, very much like, unfortunately, things like diabetes. Now, there are some patients who can be cured. These are the patients with very obvious problems that are obstructing their airway. Like for instance, if you have really large tonsils, a really blocked up nasal passage, then sometimes by correcting these issues, we can get you cured. But the far majority of patients who have obstructive sleep apnea have a combination of two factors. One is airway narrowing, their airway is narrow. And number 2 is they have poor muscle tone during sleep. So it's very unlikely that you'll see anyone snoring when they're awake. In fact, I've never seen that. And so sleep initiates a reduction in muscle tone. And that reduction in muscle tone in already narrow air passage will then cause it to block up and obstruct. So you can imagine that with surgery, with CPAP, with an oral appliance, you may be able to keep the airway open or widen the airway to some extent. But the issue of muscle tone during sleep, the decrease in muscle tone during sleep, that is not going to be changed by these treatment options that we've just mentioned. So think of sleep apnea more like a chronic disease that requires attention and care rather than like for instance an infection where you just take an antibiotic and it goes away.
Right. Okay. I think that's that's a really good way of looking at it, right?
Yep.
Okay. So, well, we always think of obstructive sleep apnea as something which affects fat people only.
Yes.
Right?
Yeah.
So does that mean if we lose weight, if I have sleep apnea and if I lose weight, it means I can be cured of sleep apnea, or at least my sleep apnea would be better?
Okay, that's also a very good question. So studies have shown that weight loss will improve sleep apnea, but it is not going to cure sleep apnea in all cases. If you were very, very, very obese, okay, what that means is that you have a lot of fat deposition in many parts of your body, including in your upper airway. Your tongue has more fat. The layers between your throat muscles has more fat, and so your airway is narrowed. So you can imagine the reason why people with a very high body mass index have a very high risk of developing sleep apnea is because their airway is very much narrowed. But if you take that away, remember we were talking about muscle responsiveness and muscle tone during sleep. That other issue is not solved. So I would say that it's not only the obese or the overweight people that have sleep apnea. We see many normal weight or even skinny people with sleep apnea. So yes, you can lose the weight. It's going to help you. It's going to reduce the severity of your sleep apnea, but it may not cure you. So that has to be borne in mind. But you know what? Every little bit helps. So losing weight or being the appropriate weight is also the right way to go. Yeah.
Right. Unless, of course, if the person's very skinny already. Right?
Yeah, then I would advise you not to lose any more weight.
Yeah, because it's not going to help, right?
Yeah, it's not.
Okay. Hey, thank you so much.
Not at all.
I think that's probably all we need to know about treatment options. Do you have anything else to add for treatment options?
Well, I would say that if you are diagnosed with sleep apnea, and if you look through all the treatment options on the internet, or if you ask your friends, and you find them largely very unappealing, I would say that don't be discouraged, because these treatment options will really help you for the long term. So, try them, because if you need treatment, you need treatment. Whether they are appealing or not, is something that we can always help you work through. So come forward if you are diagnosed, or if you feel that you have symptoms. Come forward, get properly diagnosed, get the proper treatment so that you can enjoy a long and healthy life all the way into your 80s or 90s, and what's more, you get a good night's sleep, and anyone who has ever not had a good night's sleep would know what a good night's sleep is worth. Yeah.
Okay, thank you so much, Dr. Han.
My pleasure.
Okay, so that's all for now, everyone. We will be back soon. Bye.
Bye-bye.